Hey everybody, and welcome to Alberta Impact. I'm your host, Bryce Lambert. I hope you're all staying safe and in good health. Speaking of health, joining us tonight is Dr. Jodi Abbott, President and CEO of the University Hospital Foundation. Thanks for joining us, Jodi.
Happy to be here today, and I hope everyone's well.
Yeah, no kidding. It's kind of a crazy time. It's lots of stuff going on. So first off, I'd like to congratulate you on completing your 100 days of sprint. I saw on Twitter that your team snuck behind you at your house to surprise you with a little sign on your window and stuff. So how was your first 100 days and considering all things?
You know, it's very interesting because as you enter an organization, president and CEOs are expected to put together a 100-day plan. And I, in some ways, in a fun way, called it a sprint. But I really didn't think it was going to be this kind of sprint. So it's been really quite incredible. As you enter an organization, you're listening a lot, you're learning a lot, and you're also kind of setting the path for the future. And then in the middle of it, you have a global pandemic. And, I was in healthcare previously, went into post-secondary, coming right back into healthcare and right in the middle of it all. So it's been pretty amazing. Watching a team respond when you're in the middle of it is pretty phenomenal. And really, I'm very, very proud of the team.
That's fantastic. Yeah, and I mean, they always say like what makes great leaders is a great team, and so it's super great that you coming into a new role, you can come out saying that and be super confident. It's kind of taken your sprint from that to a marathon all of a sudden, if just with the prolongedness of how this is kind of all going.
Certainly.
Kidding.
But every leader has to have the energy to do that, and this is certainly a test.
Good stuff. I want to take a look at the University Hospital Foundation. Correct me if I'm wrong, UHF consists of two other institutes as part of the foundation. Can you speak a little bit to those organizations?
Yeah, so certainly the University Hospital Foundation, our role is to support the site, so the University Hospital site. So that includes the University of Alberta Hospital, the Mazankowski Alberta Heart Institute, and the K Clinic. And so there are really three entities there. And our primary goal is to fundraise so that we can support research, innovation, the development and institution of new equipment, and look at innovation for the future.
Mm-hmm. And speaking to, the research and the fundraising, your guys' foundation, the University Hospital Foundation, has released two campaigns last week. The first one, a funding campaign for COVID-19. Can you elaborate a little bit on that?
Yes, we put something together around COVID-19 because we're seeing requests come forward. And typically we would support site-based requests. We're also seeing broader system requests because, as you can imagine, in a pandemic, you have things that come up that are unusual. And so we launched an emergency response fund. If you think about it, every Albertan, every Canadian, and I would say everyone globally is being tagged right into healthcare. All of our health is potentially being impacted, and I think in Alberta we're doing a great job social distancing and trying to manage this, but there are unexpected needs that come forward, and so we're asking Albertans to consider in their donation to give to our emergency response fund. And those funds will be used for a range of needs in the site and in the system. And a couple of things that have come forward are Text for Hope, which if you haven't gone on, you should go on to text and do 393939 and put in COVID-19 Hope, and you will get connected to mental health supports. And this is something we felt as a foundation was very important to support the funding of. So it's being supported by foundations across the province. And if you think about the fact that we are social distancing, our communication is different, our social interaction is different, making sure that you have the right supports from a mental health perspective is very, very important.
No kidding. Well, these sound like some great initiatives. And then on your second campaign, you've got the hashtag Foundation of Gratitude, which is in collaboration with 7 other health foundations. That's a
Yes.
pretty massive feat of collaboration. How did that come about, and how's that been going?
Yeah, it's very interesting because I think probably every hospital foundation or health foundation in the province is watching, because we're located right on site. So we're watching the incredible efforts of our front line, whether it's someone who works in the janitorial side or the kitchen side, to the physicians and nurses taking on a great deal, working incredibly hard. And we wanted to take the opportunity to thank them. So the foundations in the Edmonton region came together and said, what could we do that would be something that could grow not only in the Edmonton region, but provincially? And what we've asked is for people to decorate your home windows with hearts. Because really, if you think about our frontline workers, they're carrying support, their hearts, to all of us in the community. And imagine you've been working a really long day, sometimes under tough circumstances. People are sick. People need your support. A nice drive home to see hearts in the windows is a pretty incredible recognition for what you're doing.
No kidding. It's so good. You know, we always talk about the healthcare workers as the unsung heroes. So it's great that we can sing a song for them by doing something like this. That's a great initiative. We've been seeing some really cool stuff happening all around the world with people going out on their balconies and doing applause, and the fire and police getting together to rally and have their sirens on. And so this is a fantastic thing to kind of get everybody involved. It's interactive. So great on you guys for doing something like this. It's going to go a long way, and those people deserve it for sure. Like you said, they put their lives on the line every day just by getting themselves, you know, the potential of getting sick and not being able to see their family. They're kind of in the same boat as all of us, and then they're a few steps ahead because they're taking care of us. So that's a fantastic initiative.
I think we're very fortunate to have just an incredibly skilled front line, and they work hard for us every day. Absolutely. And whether you have a family member who's sick or not, they're helping to reduce the spread of the disease, which is so important.
You betcha. And so lastly, I love to talk about the Full House Lottery. I understand this year tickets will be supporting the MS Research and Care at the University of Alberta Hospital. How's the ticket sales been going so far? I know it's kind of a trying time for people to contribute, but how are things going, and how can people continue to help support you in that regards?
You know, it's very interesting because at the beginning of social distancing, we had to make some very difficult decisions. And one of them was to close the actual show homes, so the Full House Lottery homes. And we get a lot of people, particularly on weekends, that would go through, take a look at the home, and as a result, purchase tickets. And so we've had to be creative, offering virtual tours. And I must say thank you to Albertans who are supporting the lottery. The ticket sales are continuing on. So we ask Albertans to please continue to support the Full House Lottery. All of the proceeds come back to the University Hospital Foundation and the Royal Alec Foundation. So this is another great example of partnership in our city. And it goes right back into equipment, patient care, research, and innovation. So I encourage you to go to the Full House Lottery website and purchase your ticket. And we know that things are tough for Albertans, but I also want Albertans to know that your money is going to a very, very important place. And each of us in the province will benefit from your contribution.
Absolutely, and to echo we're all in this together is no more important now than ever. So thank you so much for that, and again, thank you for coming on and taking the time to be on the show and sharing what you and your organization have been doing for our healthcare heroes and for Albertans.
And thank you very much for the opportunity to tell our story, and keep doing the good work that you're doing, because you're getting great messages across. Thank
Super.
you.
Thank you so much. And thank you for the viewers for tuning in. Please don't forget to go and share this episode. Spread Alberta's positive impacts, even during trying times. So we'll see you all next week. And again, stay safe and stay healthy.
What that's called.